Now to good health. Suicide. It is the #2 killer of adolescents ages 15 to 19, and depression is a key factor in those deaths.
And now there's a new study finding that there has been a significant rise in major depression among young people in the U.S. Dr. McGeorge is here with all the details, and this is a very serious trend, Doc.
Definitely, Sandra and Devin. You know, the risk of depression sharply rises as children transition into adolescence. That's a fact we've known for some time. Unfortunately, despite that knowledge, the rate of major depression has continued to increase, even more so in one group.
The prevalence of major depression is rising for young people, but especially for girls aged 12 to 17. A study published in the journal Pediatrics examined data from more than 172,000 adolescents and more than 178,000 young adults aged 18 to 25. Researchers found cases of major depression among all adolescents rose from about 9% in 2005 to about 11% in 2014. Among young adults, they rose from about 9% to about 10%, but the biggest increase was among the group that already had the highest rates of depression, teenage girls. Data showed the prevalence of major depression among that group jumped from about 13% to about 17% in 2014 over the same period. The increase among boys was lower, and it moved from about 4% to 6%. Researchers noted there was no corresponding rise in the proportion of adolescents receiving treatment, which is especially important because in addition to being immediately helpful, it can change the direction of a person's life and promote resilience as an adult. More needs to be done to improve access to depression care for all young people, and more research is needed to understand why depression is increasing fastest among teen girls.
Now, the researchers postulated that greater use of social media and, of course, the associated cyberbullying might be contributory factors to the higher rates of major depression in adolescent girls compared to boys. And I think that's an important element. Social media is really a key thing to the whole dynamic between
the fact that in society we don't talk as much about suicide, and in the media we don't report suicides generally. There's a real miscalculation of how much of this is going on.
Oh, definitely. I mean, this is something that, and that's why the awareness element is so important, and why really we have to get the message out so that people go out and get help, because that's really the biggest shortfall right now, is that kids, adolescents are not getting the appropriate help that really sets them up for a lifetime of problems.
Yeah, because there's such a stigma on it still. We don't talk about it.
Exactly.
All right. Thanks, Doc.